Hey guys, my name is Dan and I'm a veterinarian. Welcome so much to this video. Welcome to my channel. I really appreciate it. Today, I'm going to talk about the most frustrating and challenging diagnosis that I as a veterinarian get on a weekly basis. And no, it's not the cancer diagnosis. I do unfortunately see that a lot in dogs and cats because dogs and cats live longer than ever, and thank goodness they do. And it's not even the organ failure issue. It is the orthopedic I tore an ACL issue because, my goodness, guys, ACL tears are so incredibly common in dogs, especially larger dogs, but it happens very commonly in small dogs too. And it can happen in cats too, especially from trauma, getting their leg caught or what have you. But dogs, they can just tear their ACL just walking down the hallway or what have you. Now, the reason why the ACL tear, guys, is just so frustrating to me is because it's so expensive to fix. Let me break it down for you. So, when doggies or kitties, let's say they have a skin cancer, I can go in and fix that. And it can be fixed a lot of times for, a few, less than $500. Like usually it's very affordable to fix like a skin cancer. And thank goodness we get it diagnosed, we get it fixed, and everyone goes home happy, right? That is amazing. The problem with ACL tears is we have to refer them off to see a specialist, and you're gonna need a TPLO, or a tibial plateau leveling osteotomy, excuse me. It's when they cut the bone of the tibia and they rotate it, so the physics and the geometry work, so the ACL is no longer needed, and your doggy can walk around normal again without having chronic orthopedic instability, pain, and then develop an arthritis later in life. The challenging thing is, guys, get ready for this. It's expensive. It's really expensive. So, ACL tears here in Omaha, Nebraska, I'm telling people usually expect to spend around $4,000 per knee. So if your dog tears their ACL, you're going to go to an orthopedic surgeon. They're going to say, we should do a TPLO. And you know what? If you can, you should. And it's expensive. So the challenging thing is I can diagnose it for a couple $100, sedate the dog, get a cranial drawer, x-ray, and we're done. But I can give anti-inflammatories to stabilize inflammation and get the dog feeling better and rest them. But if you want a doggy that's back to, I never say 100%, because without the normal ACL in there, it's not going to be 100%, but really darn close to 100%. And to the average Joe, and in most cases, that doggy thinks that the knee is fine and normal because they do a great job at fixing it. But what I'm trying to get at is, if you want to get your doggy back to a normal functioning doggy, you need to have a surgery. And the challenging thing is how expensive it is. And a lot of these dogs are younger. So if we're not fixing this 2-year-old's knee, you're going to have a problem. It's going to get worse and worse and worse with age. And when they're 8, you're going to have a really, really arthritic knee. And you may look back and be like, I wish we could have fixed that back when it tore. Second thing is, if they tear one ACL, they are really, really, really likely to tear the other one for a handful of reasons. But you think of it this way, guys. If the ACL just tears because it's weak, or maybe it can't support the dog's weight, or who knows what, but it's just not a great ligament. If one tears and then all the weight goes to the other side, it's going to tear that side too, right? So when one goes, a lot of times, guys, the textbook tells you the other side will go too. So if you're spending $4,000 or $5,000 wherever you live, it could be more or less, but if you're spending that much on that one knee, you're going to be spending that all over again the next year. I have a veterinarian I work with, and back when her dog tore the ACLs, she didn't. She was a veterinarian, but she knew the best option was to have a specialist do the surgery. So they did one knee, and then boom, they did the other knee, and she, is paying out about $4,000 per knee, and not to get too into the weeds, but they had complications at one point, had to have a plate removed, and the dog's doing great. It's a really sweet doggy, but The problem is people are spending a lot on ACL. So that's why it's one of the most frustrating diagnoses for me, is because I can't fix it in-house. And usually most people are so overwhelmed by the financial burden of it, they can't go and get it fixed either. So we're dealt with giving anti-inflammatories, muscle relaxers, sedatives to kind of relax the doggy, hoping that inflammation and scar tissue go down and scar tissue develops over the knee, and we get a more stable knee over about 8 to 12 weeks. But you know what, guys? It's never great. It is never great. And some people tell me they see the dog walking around normally. Maybe I'll see him the next year and it's better, but I try to think of it this way. If you have instability in me or you or in a doggy or a kitty, instability in any joint is going to lead to arthritic changes. You're going to get things called osteophytes or enthesiophytes, and these are bony projections coming off of the joint, causing chronic pain, inflammation, and if you have an unstable knee from a torn ACL, you're going to have problems later in life. So, getting back to it, the burden here is the financial burden. And it's not the fact that I can't diagnose it. It's not the fact that the pet parents want to fix it because they desperately want to fix it. And it's not the fact that we don't have the knowledge to. It's the fact that financially limitations are just so incredibly overwhelming for this procedure. Even like when I do a life-saving like pyometra, affected uterus surgery, or I remove some intestines, I mean, I'm not charging anywhere in that ballpark. Maybe it's like $1,500. Maybe if it's like life-saving, hospitalization afterwards, all kinds of crazy stuff. But to have to drop $4,000 per knee, you're gonna have to be pretty buttoned up financially to weather that storm. And I preached it before, but I'm preaching it now. If you have a big dog, any kind of dog, even the small dogs, I see a lot of small dog ACL tears. I shouldn't be hyping the big dogs. Small dog ACL tears are very common too. But for that reason, when you do get pet insurance, if we're going to go down that path right now, talking about finances, making sure that they're going to cover it. So I just want to do a quick tangent, talk about like Trupanion, for example. They will cover both knees if one knee is torn. I chatted with them in the past. Super great. Other pet insurances, once you pay your deductible out, they're going to cover the next one if it happens within a calendar year. Always look for the ACL on any insurance plan, making sure it's covered, because outside of like going to the emergency room and getting care, the ACL is going to be one of the big ticket things that a lot of doggies experience at one point in their life, and being able to fix it, because it usually happens when they're really young a lot or middle age, that's going to preserve that dog's orthopedic health for the long run, and it's going to give them a happier, healthier life. And you know what? It's going to make you feel really good when you see them jogging around after a bad ACL and they have surgery and they're jogging around and being happy, and you're going to be like, man, I was able to support my doggy and fix my doggy. And this is why I also preach the idea of having a low premium, being able to pay for your premium, not having it overwhelm your wallet, but then having a little bit higher deductible. So if you do have that huge ACL surgery cost, your deductible, you can meet that and you can afford that, and then the pet insurance will step in and be the hero, as they should be, and support you with an ACL fix. Okay, guys?